The question is, a patient complains of pain in the tooth on taking hot food. The pain subsides on taking cold. What is the diagnosis? So, these hot and cold tests are basically thermal tests. They are a way of assessing the vitality of the pulp. However, they are not truly measuring the vitality of the pulp because of pulpal vitality or vitality of any organ is dictated by its blood supply. Okay. So these tests measure the nerve supply or the nerve conducting potential of the pulpal tissue, and that is the reason why they are also known as sensitivity tests, and they help to ensure that the nerve supply which is there in the pulp at that point in time is intact and is able to carry the sensation. So this is one way of measuring pulpal vitality. The other way of measuring pulpal vitality is EPT, that is electronic pulp tester. So what you do when you're using these tests is basically you need to have control teeth. If my tooth in question is going to be the maxillary right central incisor, that is 1-1, I need to ensure that the response that 1-1 gives is somewhat similar to what the other teeth are. That is how I can distinguish whether the tooth is vital or non-vital. So in order to ensure that, I take three other teeth into consideration: the adjacent teeth, the opposing teeth, and the contralateral tooth. So what does that mean? If my tooth in question or the tooth that is required, in which the pulpal test is necessary, is 1-1, the adjacent teeth which I would be taking into consideration for the examination is going to be 2-1 and 1-2. The opposing tooth is going to be 4-1 and the contralateral tooth is going to be 3-1. So if I am taking the left maxillary first molar as the tooth which needs the pulpal vitality to be assessed, my control teeth are going to be 2-7, 2-5, 3-6, 1-6 and 4-6. So these are the teeth that need to be taken into consideration while performing a pulpal vitality test: adjacent, contralateral, opposing. Okay. Now, each tooth shows a particular response, or rather, the vitality response of a particular tooth is dictated by what is the status of the pulp. For example, if my pulp is in a state of reversible pulpitis, that means pulpitis means there is inflammation in the pulp. So, when I am going to apply a stimulus, the response is going to be early. So if the patient is having, if I apply cold on my 2-1 and 1-1, and 1-1 shows an earlier response than 2-1, that means it is in a state of inflammation. So the inflammation can either be reversible or irreversible pulpitis. Okay. More often than not, the status, if the pulpal tissue, the response is early, and since it is in a state of pulpitis, you will then go for the subjective symptoms that the patient is giving. If the patient says that there is food lodgement, and after removal of the food or after removal of the particle, the pain subsides, then it is in a state of reversible pulpitis. However, if the patient says that he is consuming food and despite the removal of the food particle that gets stuck in the cavity, the patient is still complaining of pain, that means he is in a state of irreversible pulpitis. So in such a situation, you will have to perform a root canal treatment. So that is the reason why you always have to correlate whatever tests you perform with the symptoms and the signs that the patient provides you with, so that you can come to a diagnosis and then devise your treatment plan. However, in certain situations, there are patients who respond to hot test as well as cold test differently. In some patients, you might have a particular cold test which will be there, and then after giving a hot test, there may be a different response that the patient or the tooth may elicit. However, it is not always true. More often than not, when a tooth has pulpal, so I've spoken to you about reversible and irreversible pulpitis. However, if a patient does not give any response, that means the pulpal tissue is completely dead. If it is dead, what does that mean? That the pulpal tissue has undergone complete necrosis. However, in a multi-rooted tooth, it is not necessary that all the three canals have to be having necrosed pulp. One canal or two canals may have pulpal tissue which may be in a state of irreversible or reversible pulpitis. So what you would do is you would perform a cold test, and in such a situation the patient will elicit a pain. Okay, and on applying a hot test, rather where you will take rather hot water or you will take a warm GP, the patient's pain may subside. Vice versa, what can happen is if the patient's tooth is completely necrosed. Again, this was what I spoke about when two canals are probably in a state of inflammation and one canal is necrosed. What if all the three canals are necrosed? There have been instances when there is partial necrosis that occurs of the entire of the pulp in all the three canals. In such a situation, what will happen is, what you would do, you give the patient warm or you use a hot test by using heated GP, Gatapacha. After that, when you apply a cold stick, the completely subsides. Sorry, the pain completely subsides. This is very typical of pulpal necrosis or partial pulpal necrosis as they call it. That is because the nerves which are there, they get irritated by the heat, and once they are irritated by the heat, when you apply the cold, the irritation subsides. The nerves are not or in a state of relaxation, and that is the reason why in partial pulpal necrosis you may have pain that may be aggravated by heat and that is relieved by cold. However, it is like I told you, not always necessary. Now, a very important thing, since most of you even apply for AIMS exams, if you have say a tooth where two canals are in a state of reversible or irreversible pulpitis and one canal is in a state of necrosis, their recent data suggests that you can do a partial pulpectomy. What does that mean? Wherever the canal is necrosed, you can remove the pulpal tissue from that canal and you can leave the pulpal tissue in the other two canals as it is. For this to happen, you have to have absolute isolation. The entire procedure has to be undertaken under a microscope. And lastly, you use MTA at the canal orifices in order to maintain the vitality of the pulp. Third thing, this entire procedure that I spoke to you about, the most important clinical factor which determines whether you do a partial pulpectomy or not is going to depend upon whether you are able to achieve hemostasis, that is stop control of bleeding from the pulpal tissue. So if you are able to achieve bleeding for 10 minutes, within 10 minutes, that means the entire pulpal canal is not completely necrosed and all the three canals other is not completely necrosed, and you can probably just do a partial pulpectomy or a pulpotomy and leave it as it is.